Hi everyone, and welcome. Tonight we're going to be discussing the molars, and we're going to progress through looking at the mandibular first molar and working distal, and going with the dog first, then the cat, then we'll talk about the maxilla, first molar and distal, and at each of the junctures between mandible and maxilla, I've got a video that I'll show you of the mandibular first molar extraction and the maxillary first molar extraction. We'll finish up with that latter video, and then we'll have plenty of time for questions, and we will certainly approach questions on the molars initially, and if we've got time, we can take questions concerning the entire series, looking back at some of the other webinars if you choose. So let's look at this image of the skull of the mandibular first molar in the right mandible of a dog. And when we're looking at extracting this tooth, the way we approach this is generally with a flap, an envelope flap. And there's certainly an option to do vertical releasing incisions here, diverging slightly away from the roots, and here. However, I find that it's really not necessary to do that for the most part. These roots are big, they're relatively round, and they can take quite a bit of torque compared to a lot of the roots without fracturing. So if you're comfortable doing an envelope flap, we'll show exactly where that flap originates and ends in the video. You're certainly welcome to do that, and I think you'll find that it's not that difficult to do it with the envelope as opposed to the vertical releasing incisions. The sectioning on this tooth, I find most of the time it's easiest to section here. You've got the less distance to go on the entire crown here in this location, just mesial to the distal root. So that's certainly an option. If you choose, you can certainly go adjacent to the mesial root and carry it on up this way in some similar orientation here, but I find most of the time it's easier to go right here. So let's look at conformation on this tooth, and when we do, we'll look at it radiographically, and we'll point out some of the variations that we can run into that make these extractions a little more difficult. We've got a lot more variations in the mandible in the dog than we do in the maxilla, and in the cat, certainly we have to throw in that wrench of resorptive lesions or tooth resorption that we see with that species. But for the most part, the mandibular first and second molar can have a lot of changes. So we'll look at those mainly on the mandibular first molar now, and then we'll talk a little bit more specifically about the second molar as we proceed. So this would make for a pretty difficult extraction on this tooth. What we've got going on here is we've got certainly periodontal disease where we've got bone loss, but we've also got some internal resorption going on, which weakens the crown, weakens the tooth, makes it difficult to extract in one piece. And you can also see here there's not really any good observable periodontal ligament space. So in a situation like this where we've got resorption, we don't generally have problems as long as it stays within the root structure. But once it starts to get up here and involve the crown weakens, the periodontal tissues migrate into that defect and can cause discomfort, and at that point extraction is indicated. So we need to consider both the radiographic appearance of these teeth as well as whether or not the crown is affected externally, visually, and if it is, it needs to be the tooth needs to be extracted.